The function of the heart is to pump blood. In order to do this, the cardiac muscle must contract and relax. A cardiac cycle is one complete heartbeat. We have atrial systole and diastole, followed by ventricular systole and diastole. Systole is just another way of saying muscle contraction. When muscles contract, they depolarize. This is an electrical event that can be measured. Diastole is simply a way of saying relaxation. When cardiac muscle relaxes, it repolarizes, another electrical event. So one complete heartbeat is atrial contraction and relaxation, followed by ventricular contraction and relaxation. Skeletal muscle cells have to be told to contract by a nervous cell impulse. There are certain cells in the heart that are said to be autorhythmic. They can discharge on their own. They don't need to be triggered by anything outside of the heart. These autorhythmic cells make up the cardiac conduction system of the heart. Sinoatrial node, or the SA node, the atrioventricular node, or AV node, the atrioventricular bundle, also known as the AV bundle or the bundle of His, the bundle branches, and the Purkinje fibers. These are areas in the heart where autorhythmic cells are clustered. The SA node is located in the upper right atrial wall. Now, when these cells discharge, because all of the other heart cells are connected to each other by gap junctions, all of the cells get the message to contract. So this one little group of cells discharging causes all of the other atrial cells on both the right and left side of the heart to contract. There is a connective tissue band between the atria and the ventricles, and this acts as an insulator. So the ventricles don't get the signal. In order for the ventricles to get the signal, the SA node contacts the AV node. Part of sending the signal across both atria is also to send the signal to the AV node. The AV node will then pass the signal down the bundle of His, which is in the interventricular septum. About halfway down, this bundle branches into the right and left bundle branches. These take the signal to the Purkinje fibers. The Purkinje fibers are spread across both ventricles, so this is going to signal all of the cells of the ventricles to contract simultaneously. The SA node sets the pace. It fires about 75 times per minute. Whenever the heart is beating around 75 times per minute, give or take a little bit, we say that the heart is in normal sinus rhythm. If the heart rate is greater than 100 beats per minute when the person is at rest, that's a condition known as tachycardia. The danger here is as the heart beats faster and faster, it is more likely to go into fibrillation. A rate less than 60 beats per minute is known as bradycardia. A rate this low typically means the heart is not beating fast enough to efficiently pump the blood to all of the organs of the body, particularly to the brain. Well-trained athletes, as they're training their skeletal muscles, are also training their heart muscle. They may have rates that are below 60 beats per minute and they're perfectly healthy, but their beats are so strong and there's so much force behind their blood that they don't have any trouble circulating blood throughout their entire body. Electrocardiography, or the EKG, is simply a measure of those electrical currents that are generated and transmitted through the heart as the heart cells depolarize and repolarize. We get three deflection waves: a P wave, a QRS complex, and a T wave. In a healthy heart, these waves are the same size, duration, and have the same timing. Changes in this pattern can reflect heart damage or problems with the conduction system. An EKG tracing will look like this. The first little wave is the P wave. This is what's going on when the atria are contracting. This is the electrical disturbance of the atrial muscle cells contracting. The QRS complex is this big spike, and this is the electrical disturbance of the ventricles contracting. There's a lot more muscle tissue, so we see a lot more disturbance. And then we see the T wave, which is the ventricles repolarizing or relaxing. We don't see the atria repolarizing because they happen right here just as the ventricles are beginning to contract. So the ventricle contraction masks the atrial relaxation. When you listen to the heart, you hear two sounds. These are the lub-dub. These are the sounds of the heart valves closing. The lub is the atrioventricular valves closing. The dub is the semilunar valves closing. You can listen to different places on the chest to hear the different valves. If you listen in the second intercostal space, either to the right or the left of the sternum, you will hear the semilunar valves more clearly. If you listen in the fifth intercostal space on either side of the sternum, you hear the AV valves more clearly. Heart murmurs indicate that the valves are not closing completely, and you're hearing blood flow backwards in the heart. So heart murmurs indicate backflow. This is known as valvular insufficiency, and it means not all of the blood is going in the correct direction. Another way to evaluate heart rate is to take the pulse. Pulse points are areas where arteries are close to the surface. You can push on them and trap them between your fingers and a bone and feel the pulsing. What you are feeling is the rebound of the artery as the blood pulses through it as a result of the heart contracting. This is an easy way to monitor heart rate. Now you can see there are several places where we can find pulses. The radial artery in the wrist on the thumb side of the wrist is one of the most common places that a pulse is taken. The common carotid artery in the neck is another place that's checked. The brachial artery is not such a good pulse point, but you do need to know about the brachial artery for taking blood pressure. The femoral pulse can be felt here where the leg joins the body. The posterior tibial artery is right behind the ankle. And the dorsalis pedis artery runs across the top of the pulse. This is called the pedal pulse. And if they're checking blood flow to the leg, these lower ones are the ones they use to make sure that blood is traveling all the way to the foot. In order to take a blood pressure, you need a sphygmomanometer and a stethoscope. Sphygmomanometer is the word that means blood pressure cuff. You use the sphygmomanometer to completely close the brachial artery, and you use the stethoscope to listen for carot cough sounds. You put the stethoscope on the brachial artery in the antecubital area and you listen for the first sound. The first sound will occur when there's enough pressure behind the blood to force blood through that compressed brachial artery. This will be your maximum blood pressure or your systolic pressure. You continue to listen until you don't hear sounds anymore. The last sound was your diastolic pressure. This means the artery is now completely open and the blood is no longer hitting the artery walls. That last sound can be tricky because you won't be paying attention to the numbers on the dial and you may miss it. So it's always important to be looking at the dial on the blood pressure cuff every time you hear a sound.